On September 21st, 2023, the HIV Legal Network brought together frontline staff, directors, and peers from violence against women shelters, emergency shelters, and transition houses across Canada to learn how these organizations remain accessible to all women and gender-diverse individuals fleeing violence, including those who use drugs.
So when us as an agency, we have to deal with the grief and the loss of clients because of their lack of ability to share with us what they actually needed because of the stigma and the shame that comes along with substance use, especially for moms.
What we're noticing within the shelter population is that women who use drugs are increasingly requiring shelter, and the women who need it most are not accessing it.
Women are dying. Women are dying and they need access. Yeah, so they need access to these materials, they need access to the support, they need access to harm reduction.
We need to be accessible to the population who need us the most.
Gender-based violence is the most pressing health risk to women and gender-diverse people in Canada. On any given night, thousands sleep in shelters because of violence at home. Women and gender-diverse people who are exposed to violence are more likely to use drugs, and women and gender-diverse people who use drugs are more likely to experience violence. Yet those who use drugs are frequently barred from violence against women shelters. A 2021 national survey found those who used drugs were barred from shelters at a rate that was 3 times higher than those who did not. An increasing number of violence against women shelters in Canada are recognizing the urgency to move towards low-barrier models that embrace harm reduction and support their clients wherever they are. For some shelters, this shift came from a realization that abstinence-based programming was a barrier to achieving their mission of serving those most in need.
I think it's probably started a few years ago after having run programs for a number of years that were sober living. It wasn't working. It just wasn't working. And so the agency itself was moving towards more harm reduction services. We saw the need within the community, particularly after the pandemic. Things got a lot worse in the community, and we just knew that we had to start providing what the community needed and was asking for.
We made the transition to harm reduction, I would say, very organically. So we got really, really good at working with women who were situationally homeless, who had resources, who had supports, who were low need, no barrier. We got really, really good at helping women who didn't need our help and patting ourselves on the back for it along the way, while amassing an 80-person barred list of really high acuity clients who had comorbidities, who were substance using, who had mental health concerns. And when we became really data focused and we really became focused on our mission of we exist to provide shelter, we noticed that the women who need it most are not accessing it.
Low-barrier shelters are leading the way in eliminating the culture of punitive rules and harmful policies that effectively prevent women and gender-diverse people who use drugs from accessing shelter services. Fostering safe and trusting environments has meant proactively protecting all shelter participants' safety. It has meant training staff in harm reduction, ensuring that staff adopt harm reduction values, and providing opportunities for staff and participants to learn from each other. It has also meant clearly communicating to participants that drug use alone never justifies the involvement of authorities, and that shelters aim to support participants and resolve issues internally. Crucially, these organizations hire people with lived experience of drug use to provide programs and services.
I made a promise to myself when I stopped using and everything, is that I wanted to give back. And I wanted to help any woman who was there when I needed someone to come and just give me a little harm reduction philosophy, which is really common sense, right? And empathy, right? And valuing someone's life, to me personally. So, that's what keeps me going.
Many peers working in the shelter system have experience of intimate partner violence, and some peers have experience of once residing in the shelters where they now work. Like Stephanie Sanderson, who now works at the North End Women's Centre in Winnipeg. She has seen firsthand how a shelter can transition to being low barrier.
For me personally, the changes I've seen from going from sober living to harm reduction is less people actually dying around our community. You know, like a lot of people were overdosing and dying. So from them to now, I'm noticing a lot of people are overdosing but being saved, not dying because of naloxone, because of harm reduction, and because of the work we do every day.
Outreach to Indigenous communities is a crucial piece of the work. Indigenous women and gender diverse people living in Canada experience gender-based violence at grossly disproportionate rates. Indeed, in 2021, the rate of femicides with Indigenous victims was more than triple that of women and girls overall. In line with the inquiry into missing and murdered Indigenous women and girls calls for justice, low-barrier shelters must find ways to decolonize and provide culturally appropriate services to women and gender-diverse people seeking shelter from violence.
Having Indigenous cultural liaisons at the program that are able to bring cultural support, bring elders, bring ceremony, bring events, bring the medicines, I think is really important too. So that what that does is it really nurtures cultural safety, where we've never had that before, but now it's a priority with the organization.
I mean, we partner wherever, whenever we can. It's been nothing but positive.
Transitioning to a low-barrier model presents some unique challenges, but Violence Against Women shelters are finding ways to work with their shelter participants, staff, and neighbors to provide education around harm reduction and the urgent need to provide services to all women and gender-diverse people.
We haven't had a big pushback. It's been embraced in the community that we're in terms of the harm reduction and the supplies that we hand out. You've got to do it, from my perspective, slow and methodically. And you've got to make sure that your staff are on board and that they're constantly being educated around what does harm reduction mean. Because it can be many things for many people. It's not just about substance use, right?
One of the things that worked really well with one of our programs is we held a big barbecue for the whole neighborhood, and we had everybody come down, and we were able to create relationships with them. So when things were happening, they knew our faces and they knew who the staff were, so they could come to us.
You know, when we had quite an epidemic a while ago with overdoses, I think word got out that we were using naloxone whenever we needed to, and people were on our property all the time. I think they viewed it as a safe space, so they knew there was help if they got in trouble.
In working towards low-barrier models, shelters are finding that they can meet the needs of all women and gender-diverse people who need services. No one is left out.
We're not asking people to leave because they're using substances. We're recognizing and realizing that folks are coming in off the street who sometimes haven't been housed in a year, you know, and so they might not stay every single night because they're not used to it. It might take them 3 or 6 months to get used to having a safe place to come home to every day. And it's been nothing but positive.
In the beginning, in your infancy, harm reduction feels like this tangible thing that you can just hold and sit on a counter and say, look, I do harm reduction. And we view it more as like, it's all these little threads. It weaves through every policy. It weaves through every procedure. It weaves through every community event we go to. And I think viewing it that way has really helped with internalizing the messages of it, as opposed to it being this sort of one and done, yes, I do harm reduction. It's really that process of internalizing it into the values base and the mission of your organization.
Harm reduction is solidarity. Harm reduction is clarity. As I said before, it's harm reduction meeting people where they're at. And harm reduction is non-judgmental.
Everyone deserves a place to live, a place to call home, a place to feel like they belong, you know, to be around people who care, and they deserve to live.
Our roundtable discussion brought up recommendations for both shelters and governments, and the following recommendations are born from the HIV Legal Network's synthesis of the roundtable discussions and a review of the literature. For Violence Against Women shelters, we recommend that they 1. Establish and maintain low-barrier admissions, including clearly and publicly stating that women and gender-diverse people who use drugs are welcome and will not be punished for drug use. 2, develop and implement policies that establish participant-centered expectations rather than punitive rules. 3, foster a trusting environment, recognizing women's intersecting identities by employing peer workers and laying out how parents will be supported and when authorities will be called. 4, ensure that women and gender diverse people who use drugs have access to comprehensive and non-judgmental harm reduction programs. Crucially, these efforts must also be supported by governments. We urge all levels of governments to 1, increase funding and support to violence against women shelters to allow them to adopt low-barrier models focused on harm reduction. 2, expand harm reduction services more broadly to meet the needs of women and gender diverse people. 3, develop and promote child protection policies that recognize drug use as separate from child abuse or neglect. We urge the federal government to decriminalize drug possession for personal use and the sale or sharing of drugs for subsistence to support personal use or to provide safe supply. We urge provincial governments to develop violence against women shelter policies that are centered on harm reduction principles, removing barriers for all women and gender diverse people, including those who use drugs.